Okay, how to discuss getting new healthcare referrals into your clinic from medical doctors that are your existing connections. So in this scenario, you have a network of physicians who you refer your patients out to who are providing quality care. The issue is that they are not referring any patients back to you. We had this happen to us early on, mainly with an orthopedic group who had in-house PT and was not referring to us. And what I learned from that, what we learned from that specifically, was if you want to keep those new patients coming into the clinic, you have got to pivot. You've got to pivot to other medical providers that have the patient base, but also are willing to refer those over to you. And we've had great success with orthopedic surgeons, neurosurgeons, pain management physicians, etc., when we had that tough discussion. And what it looked like was basically sit down in person. That always seems to work better than over the phone, or text message is the worst. There's no tone. Definitely don't text, that physician. I would sit down, look that physician in the face, and then just have a heart-to-heart. Explain that you're very happy with the way the patient care has been. However, there has not been any synergy back and forth from their clinic to yours. And there could be a couple scenarios happening here. Again, number one, they could have in-house PT and could be referring it there. Number two, they may not have realized, if you didn't lay out the expectations clearly up front, that you wanted patients back. And if you did lay them out up front and made it known that you expected for this to be a synergistic relationship with cross referrals, they may not have known that they weren't sending anything your way. So it's going to be important to, again, not have a knee-jerk reaction, but to address this issue, to have the hard discussion, and just tell them exactly what you're looking for. Explain that it's been X number of months, or maybe even years in some cases, you've referred over a significant number of patients and you've received X in return. And we're never going to do a tit for tat, a one for one, anything like that. Again, it's all about quality patient care. But at the end of the day, there's no way that an orthopedic physician, a pain management physician, really any specialty MD out there, or primary care physician for that matter, doesn't have patients to refer back. And if they are not willing, after that sit down and that heart-to-heart, and you've laid out what you expected, to refer to you, to refer to your clinic, there has to be another barrier. Either they don't understand what you do, there's some kind of disconnect in their clinic for who's referring those patients out, who's discussing where they're going to get their therapy, where they're going to get their chiropractic care from, or maybe at the end of the day, they just don't want to refer over. And if that's the case, it's going to be important for you to recognize that and move on, pivot to another healthcare provider. I'm sure in most cities there's going to be multiple neurosurgeons, multiple orthopedic physicians, pain management specialists, etc., that you can pivot to, who will again provide the care that you need, but also work to build a rapport with and have that synergistic new patient referrals going back and forth. So that's going to be extremely important. Again, hard discussions. They are hard because you don't want to upset somebody, but in the end, you're only upsetting yourself and your clinic by really not getting what you deserve. So make sure you address it if you're working with medical specialists who you're referring patients to, who over time are not referring back into your clinic. My name is Dr. 𝒊𝒕'𝒔. If you want to learn more about this and PI in general, go ahead and check us out at PIExpertsecrets.com.